Everybody suffers from anxiety at one time or another. But people who have abnormal anxiety syndromes turn to medications to assist them with their anxiety. One such medication is Xanax. But Xanax, unfortunately, can cause dependency. In this video, we take a look at just how the drug does that. Anxiety is a common neuropsychiatric condition that affects most people at some time in their lifetimes. It is a normal reaction to stress or stress, but people sometimes can have abnormal patterns of anxiety, such as GAD or generalized anxiety disorder, social anxiety disorder, or panic attacks. Many people with abnormal anxiety syndromes have found relief from their anxiety by taking Xanax, a member of the benzodiazepine class of drugs. But Xanax can cause physical dependence, which leads to withdrawal symptoms when patients stop the drug. During a withdrawal, patients experience sleep disturbances, irritability, increased tension, panic attacks, or even seizures. Most cases of dependence with Xanax occur at doses of 4 milligrams per day or higher, and dependence can occur after relatively short periods of use. But how does Xanax cause dependence? To answer that question, we have to examine the physiological changes that take place in the brain during anxiety. Nerve impulses in the brain are transmitted from one nerve to the next by neurotransmitters, which are chemicals that are produced by the nerves. In anxiety, the most important neurotransmitter is GABA, or gamma-aminobutyric acid. Gamma-aminobutyric acid is the most prevalent inhibitory neurotransmitter in the brain, which means that it blocks the transmission of nerve impulses from one nerve to the next. Studies have shown that the level of gamma-aminobutyric acid, is abnormally low in patients with panic disorders. The levels of GABA found in generalized anxiety disorder were not low in all of the studies, but there were different techniques used in these studies that may explain these unexpected results. Xanax is a GABA receptor agonist, which means that it binds to the receptor and stimulates the receptor and produces the same blocking effect that GABA produces in the brain. This leads to the sedation and the sleepiness, drowsiness, and the calming effect that this drug produces. GABA, however, is counterbalanced by another neurotransmitter in the brain known as glutamate, which stimulates and agitates the brain. And it is the balance between these two neurotransmitters that ensures the normal functioning of the nervous system and a stable emotional state. Any changes in the blocking effect of GABA are compensated for by increased sensitivity of the receptors for the glutamate neurotransmitter. When patients with anxiety take Xanax, it binds to the GABA receptor and increases the blocking effect of any GABA that is left in the brain. To compensate for this, the sensitivity of the glutamate receptors increases so as to avoid too much sedation. As time passes, the sensitivity of GABA receptors to Xanax decreases. And this means that more and more of the drug has to be used to achieve the same effect. This is what is known as tolerance. This is a vicious circle, and the sensitivity of the glutamate receptors, the excitatory receptors, increases even further. Upon the abrupt stoppage of Xanax, all stimulation of the GABA receptors ceases, and the system is therefore left with an excess of glutamate, the excitatory neurotransmitter, which leads to the tremulous and the lack of sleep and the rebound anxiety and panic attacks, and even seizures. In order to prevent this, therefore, it is important that Xanax is always tapered very slowly, and it is recommended that the dose should not be decreased by more than 0.5 milligrams every 3 days. Thank you for watching. I hope you enjoyed this video. If you did, like, share the video, leave your comments in the box below, and support the channel by subscribing. I'll see you in the next video. Take care.